We at Natera appreciate your consideration of our lab as the provider for your preimplantation genetic diagnostic, or PGD, testing. We hope this brief presentation will be able to answer many of your questions about our testing purpose, process, and options. In this presentation, we will provide a brief overview of Natera's Spectrum preimplantation genetic diagnosis using parental support technology, including the purpose of the testing process, and the benefits of the testing. This presentation is meant to provide you with basic information about our test. For a more in-depth discussion, including information tailored to your specific reproductive history, you will have a private phone consultation with one of our board-certified genetic counselors. Couples in which one or both of the partners have had genetic testing confirming that they are either affected with or are known carriers of an inherited single-gene disorder are candidates for single-gene PGD. PGD can only be done as part of an IVF cycle. The purpose of PGD testing is to screen embryos for genetic changes or mutations known to be present in one or both parents. This allows your IVF doctor to select those embryos with results that indicate the embryo is unaffected with a specific gene disease for transfer, greatly reducing the chance that any resulting children will have the genetic disease of concern. For example, if both partners are carriers of cystic fibrosis, the embryos can be screened for both the mutation carried by the father and the mutation carried by the mother. In this way, embryos that have neither mutation or only one mutation can be selected for transfer. It is these embryos that are most likely to develop into babies who do not have cystic fibrosis. All single-gene testing at Natera includes 24-chromosome screening. Here are some of the benefits of single-gene testing plus 24-chromosome screening. First, a brief explanation of chromosomes. Chromosomes are structures in the cells of our bodies that contain the genetic information that tells our body how to grow and develop. Normal human cells contain 46 chromosomes, or 23 pairs. Half of our chromosomes are inherited from our mother and half from our father. When there are too few or too many chromosomes in the cells of an embryo, this can result in no implantation, miscarriage, or the birth of a child with significant birth defects. Missing or extra chromosomes can happen in any pregnancy, and this is the result of a random error, either in the egg, the sperm, or one of the very first cells of the embryo. Although anyone can have an embryo with missing or extra chromosomes, the risk increases with the age of the mother. Choosing single-gene testing plus 24-chromosome aneuploidy screening allows your IVF doctor to select embryos for transfer that are both free of the single-gene disease of concern and have a normal number of chromosomes. Embryos that are unaffected with the single-gene disease of concern and chromosomally normal are more likely to implant and less likely to miscarry. This type of testing can be done on day 3 samples, but more commonly is performed on day 5 or 6 biopsy samples. For more information on 24-chromosome screening, or PGS, please click and watch our PGS video located on the same page of our website as this video. This table illustrates the chance of missing or extra chromosomes in day 5 embryos in live-born children by maternal age. Based on our data and the medical literature, we know that a significant proportion of day 5 embryos have a chromosome abnormality. For day 5 testing, the rate of chromosome abnormalities for women less than 35 years of age is approximately 32%, and in women 35 years and older, the risk increases from 50% to over 75% in women 40 years and older. The rate of chromosome abnormalities is even higher for day 3 samples. This means that for older women, there is a significant chance that there may be no embryos with normal chromosome results to choose from for transfer. Some of the drawbacks of single-gene testing plus 24-chromosome screening are summarized here. Because single-gene testing plus 24-chromosome screening can identify those embryos with missing or extra chromosomes, you may have fewer embryos with normal results to select for transfer, or no embryos for transfer, depending on your specific single-gene disorder, age, and the number of embryos available for testing. There may also be embryo samples that do not return results or have inconclusive results. Also, even if you transfer an embryo with normal results, this does not guarantee a pregnancy. Next, there is always a chance of mosaicism. Mosaicism is when there is more than one cell line present within an embryo, meaning there could be a mixture of some normal and some abnormal cells. This means that the cell or cells tested may not represent all of the remaining cells in the embryo. An embryo with abnormal chromosome results on the tested sample may have normal cells in the remaining embryo, or an embryo with normal chromosome results on the tested sample may have abnormal cells in the remaining embryo. Mosaicism is less of an issue with day 5 testing versus day 3 testing, but the chances are not zero. Lastly, there is a potential for misdiagnosis with any form of PGD testing. Thus, prenatal diagnostic testing, either through chorionic villus sampling or amniocentesis, is recommended on all resulting pregnancies to confirm the results of the PGD testing. This slide reviews the initial steps for Natera's single gene testing process. First, your IVF center sends a PGD referral and your genetic testing reports to our lab. Second, an initial phone consultation is scheduled with you and one of our board-certified genetic counselors. During this phone call, the genetic counselor will review the test process, test options, and ask you which family members are available to provide DNA samples. Third, the Natera genetics team will review your mutation reports, family history, and the available family members to determine whether we can develop a test for you. We can typically inform you and your IVF center within 1 to 2 weeks whether a test can be created for your specific mutations. If Natera is able to develop a PGD test for you, then a second phone consultation will be held in which the Natera genetic counselor will review the test consent forms and test outcome expectations, discuss samples needed, and review the test development process. Next, DNA collection kits will be mailed directly to you and other family members as needed. Once these kits are returned to Natera, our laboratory begins your test development process immediately. The test development process typically takes 4 to 8 weeks. Once Natera has developed and validated your custom PGD test, the genetic counselor will contact you and your IVF center directly to let you know that we are ready for you to start your IVF cycle. The total test development time from the date your IVF referral is received by Natera averages 10 to 16 weeks. This timeline briefly overviews the steps taken by Natera as discussed on the previous 2 slides. We ask that no IVF medications be started prior to the PGD test development being complete. Single gene testing includes 24 chromosome screening and can be done either on a day 3 or day 5 embryo biopsy sample. There are additional fees if you want us to test for multiple diseases and/or HLA matching. There is also an additional medical courier shipping fee. If you need to pursue multiple rounds of PGD testing, subsequent cycles of testing are billed at a discounted price. If you haven't already spoken with one of the genetic counselors at Natera, one of us will be contacting you shortly to discuss your case. Urgent questions can be emailed to us directly at singlegenepgd@natera.com. You can also look on our website, www.natera.com, for additional information.